Hi, my name's Dr. Kathleen Carson, and I'm here to talk to you about clear aligner orthodontics and how we do them a little bit differently in our office. First of all, orthodontics is not just about a nicer smile. Sure, it is going to boost your self-confidence and give you a prettier smile, but it's also about the health and longevity of your teeth and your gum tissue, about how your teeth function. It can improve your speech, and on a bigger picture, it can actually improve the health and function of your TMJ joints, and when done properly, can even improve how you're breathing day and night. Let's talk about clear aligner orthodontics and how it's a little different today. In the past, you might have considered this a longer course of treatment, maybe a little more expensive, not for the more difficult cases. None of that is true anymore, and I'd like to tell you a little bit about why. We're gonna look at the manufacturing, the materials, the biomechanics, that's a fancy term for how teeth move, and how we monitor the cases so that these results are better, more predictable, often take even less time than traditional orthodontics, and can be done in a very comfortable way, even from the comfort of your own home. So first of all, technology has advanced, right? In all aspects of the world. This is no different. Our models are better, our materials are improved, things are more accurate and predictable today. In the past, aligners might have been a little uncomfortable to wear. Plus, we would have to get you in to monitor how they were fitting and how your teeth were moving with them pretty frequently to get good results. Nowadays, it's done a little bit differently. The aligners aren't just arbitrarily spaced. It's a custom program for you. And we can even monitor this remotely, so you don't have to come in so frequently for me to check you. I'll tell you a little bit about how that works soon. Compliance matters, right? You have to wear the trays to get them to work. In the past, maybe they weren't so comfortable. They were really obvious that you were wearing them. Maybe you had an event you were going to and you just didn't want to wear them like you should. That would impact the results of your treatment. Nowadays, the materials that we're using are far more comfortable. They last longer. You can't even see that they're in your mouth. And you don't have to come in so often for me to monitor it because I can do this remotely with your help. In addition, durability of the materials matter, right? In the past, they would lose their elasticity and not be as effective. Nowadays, the materials last quite a bit longer, and they also stay really good looking. They don't get dingy yellow and brown like they used to, right? I actually have patients in my practice that come in wearing their aligners, and I have to ask them if they're in their mouth. And I know what I'm looking for, and I can't even tell if they're wearing them. The design of the aligners is even different, right? How we trim it makes them more comfortable, last longer, and this is the biomechanics part that I was talking to you about. How the teeth move is actually different based on how the aligners are shaped to fit over your gum tissue. More comfortable, and the teeth move better. In the past, we had to put these weird little buttons on your teeth, right? They're called attachments, making it really obvious what you were doing and that you had orthodontics going on in your mouth. Maybe they felt weird and were uncomfortable, hard to chew with. Nowadays, it's extremely rare that we even have to use these attachments, which makes it more comfortable, less obvious you're wearing them, and the teeth are still moving in very predictable manner. So let's talk about monitoring too. So we've got the materials that are better, they're more comfortable, they're easier to wear, the teeth are moving in better ways. No longer do you have to come in every 3 to 4 trays, every 6 to 8 weeks for us to make sure the trays are fitting well. Of course, you always can come in and see me, but you don't have to anymore because we have the ability for you to take photos at home of the progress of your treatment and for me to check it online in a portal that you upload these pictures to. And I can tell just how well you're moving along with your process and if any changes need to be made or not. This is an example of that remote monitoring process. So you take the photos at home, we give you all the equipment you need, it's incredibly easy, you use your cell phone, you upload it to this portal, and I can monitor each step along the way. I can send you text messages or emails, I can pick up a phone and call you. If you need or want to come in and see us, we can. But there are times when we can go through this whole process and you don't even have to come back into my office until the very end. For this very reason, we actually have clients and patients all over the world that are going through this process with our office and being monitored remotely, getting a great result. This is an example of how that remote monitoring process looks over time. You can actually see the changes yourself as well. You can reach out to us at any time and we can reach out to you. So in summary of the process of treatment, in the past, this is what your treatment process might have looked like. You would come in and get your records taken, maybe have a bunch of goo put in your mouth, right? Remember those days? Terrible. Then you would have to come back in, We would probably put some buttons on your teeth, maybe trim a few of those teeth down, deliver the aligners, send you home, and get you back, probably in 4 to 6 weeks, to make sure things were fitting and going well. And if they weren't, we would either have to backtrack you up, maybe start over, or maybe plan on a longer treatment plan. And this happened all the time. Very frustrating for both patients and the clinicians. And at the end of treatment, oftentimes we would have to take new records and do a whole nother slew of trays because we didn't get the results that we wanted and were aiming for. And there were a lot of reasons for this. Nowadays, that's also incredibly rare. It's a much more streamlined process. Today, this is more what the patient's journey looks like. You still have to come in and see me. I still have to get the records, find out what you need, and come up with a plan for you. No more goo though. It's all digital, including the impressions of your teeth are done with a digital camera that scans your teeth and gets also uploaded so that we can visually look at it together. We come up with a treatment plan online, which I can share with you, either in the office if you want to come in, or remotely. I can send you a link and actually show you the plan changes of your teeth. And then you have an option. We can either get the aligners sent to our office and you come in, we try them in, and we walk you through the steps of the process person to person. Or if you prefer, maybe you're out of town or you live in another country, or you just don't want to come in and do it this way, we can actually send the whole kit to your home. It's very simple to use. Instructions are in the box. There's an online presentation, or you pick up the phone and one of my assistants or myself walk you through how to do it and get you set up with the process. You don't even have to come back in for delivery anymore. You can do this at home. Then you take pictures along the way, you upload them to that portal I showed you, and we can course correct as needed without you actually coming into the practice and monitor the whole process. The results, they're happening faster, more predictably, more comfortably, and you don't have to take time out of your busy schedule to come into an inconvenient appointment if you don't want to. Of course, we're always here if you do. Those biomechanics, how the teeth move, in the past, if there wasn't enough room for all your teeth, we only had so many options, including taking teeth out, pulling things back. It was not the best for the health and longevity of your teeth or your overall health and well-being. Now with the new systems, we can actually create more room for the teeth, expanding the bone out and getting the teeth to line up in ways where they're going to function better, last longer, and be healthier overall for you. So let's look at a couple cases. This is the fun part. This is a pretty basic, straightforward, my teeth have crowded. Maybe you didn't wear your retainers after you had braces as a kid, and things have shifted. I see this all the time. Can't you just straighten them up? So we get records like this, and then we can come up with a treatment plan that actually shows us how your teeth are going to be moving. You can see on this how the teeth are getting broader, we're creating more space, and they're lining up. And this is all before treatment is done. It's even before the trays are made, so that I and you can look and see that you're going to be happy with the proposed end results before we fabricate all these aligners for you. Here's a different view of those teeth moving. And you can see how we can actually get changes to the bone now using the aligners so that there is more expansion and room for those teeth. And in this particular case, this is the remote monitoring of this patient. And what you're gonna see is those blue dots all across that line. That tells me that the trays are fitting exactly like they should and the case is progressing exactly as planned. Never had to see this patient from start to finish, and the results came out exactly like the computer laid them out to be. And all of this monitoring was done from the comfort of their home or office or vacation or wherever they happen to be, and I could log in and give them feedback. This is what that monitoring looks like over time. You can actually see the changes happening. It's pretty cool. This is the before and after. It took about 6 months. So let's look at a maybe more complicated case. This person, their arches, the shape of their jaws, much more narrow. Teeth are more crowded. Somebody might look at this and say, there's just not enough room for all of those teeth. But again, with the new biomechanics and the new materials of these aligners, we can actually create the space that's needed for all of these teeth to fit. You can see in the mock-up the changes of the teeth that are happening, that are proposed to happen, right? In the past, doing this with aligners was not possible. So let's look at their progress. Look at the changes of the arches that are happening with this computer simulation. You know, is this possible? Can we actually achieve this? The answer is yes. You can look at the remote monitoring for this patient, and again, you see green circles all the way across. That means the movement that we proposed on that computer simulation is happening exactly as planned for this patient. Each time you see that dot go across, that's a new tray that this person is changing into and taking photos so that I can check it online and see how the progress is happening. And you can see the whole progression. You can see it from your home, you have access to this, I can see it from my office. Again, before and after, went exactly as planned with comfortable aligners, no buttons, super easy to use and process. So let's look at a more complicated case, right? This is one where not too long ago, we would say, no way can this be done using clear aligners. Look at those teeth aren't even in the right position. How in the heck are you gonna get them to move into the right spot? Well, here's that computer simulation again, right? You can see the teeth actually moving, what we're thinking. Look at that tooth move. In the past, using old aligner systems, there is no way that movement would have been possible. It would have been extremely complicated using regular braces even. Now with the aligners, we can actually do more than regular braces, do it faster, oftentimes cheaper, and way more comfortably. Now you're gonna see the importance of the remote monitoring system, because those red squares that you see along that line, that's when those trays weren't necessarily fitting like they should. And we're able to communicate that with the patient through the text messages or emails and tell them, wait, stay in that tray a little longer, because all teeth don't move the same and at the same rate. Sometimes they need to stay in the trays a little bit longer. So with the remote coaching, this patient was able to stay with their original course of treatment and still get those predictable results start to finish. We just had to have them alter how long they're using their trays for, which can be easily done. And it's important to do this on a tray by tray basis, because that way we know exactly when it's important to stay versus go. You can see the results were still obtainable. We never thought this was possible before. And here's that person's before and after. That's amazing. Took a little longer, probably a year, but still, look at those changes. Comfortable, easy to wear, reliable, and you get those results. So that summarizes everything I wanted to share with you. Why we can do so much with clear aligners, how we're changing how we're treating patients, how we're making it easier on you to get the treatment you need from anywhere in the world, really. So if you want to find out more, find out if you're a candidate. Maybe it's 3 months of treatment, maybe it's a year or a year and a half of treatment. Everybody's going to be a little bit differently, and we're going to treat you how you need to be treated for your desired results. Come in and see us. We'd love to give you our opinion.